Senator Casey.
Let me start by thanking you, Mr. Chairman, and the ranking member for having a hearing on this range of critically important issues, whether it's diversity of the workforce or whether it's health disparities or maternal health or maternal mortality. And I believe that in order to nurture a future generation of black and brown healthcare workers, or in order to close gaps between outcomes for white and black mothers, we have to start in childhood. And that means that the Congress of the United States has to get into the game in a way that we haven't ever really. I believe it comes down to at least 5 basic freedoms that every child should have a right to enjoy. And we should invest in those freedoms, not just talk about them like they're platitudes. The freedom to be healthy, the freedom to learn, the freedom to have economic security, which means giving children the opportunity, their families the opportunity to save at a very young age for their future. The 4th freedom would be the freedom from hunger, and the 5th freedom would be the freedom to be safe from harm. If every child has those 5, health, the opportunity to learn, economic security, freedom from hunger, and to be safe, we will have a much different outcome on all these issues we're here to talk about. But the federal government hasn't done that. And so I think it requires a maximum commitment to our children. I'll start with Dr. Lawson. You had talked about the improved outcomes patients have when they're able to see healthcare providers that look like them, a very important point to make in this hearing and beyond. In the context of maternity care, what has your experience been with both midwives and doulas, and what role can they play in reducing health disparities?
Absolutely. Thank you, Senator. I've had a 22-year history or experience in OBGYN. My entire career, I've worked with midwives and doulas. I even owned a birth center myself and employed midwives. Very impactful. Number one, I believe women should have a choice with what type of provider they want, and that's what midwives can do. I think that doulas are an excellent support for women. They were an extension of me. I could send the doula to the house, help a woman in early labor, postpartum checks, mood disorders. Sometimes they would share things with the doula they may not want to share with me. So very important aspect, an add-on support for women during pregnancy and childbirth.
Well, thank you. We're all trying to do more to invest in programs that would support doulas and midwives. Dr. Galvez, you mentioned the role of community colleges in helping to develop the pipeline of healthcare workers and for diversifying the workforce. Community colleges are the most diverse sector of higher education. I know that just from representing Pennsylvania. We've got 15 community colleges, and I'm amazed at the sophistication of the curriculum and how well prepared young people are coming out of those community colleges. How can we better use the opportunities that community colleges offer to help grow and diversify the healthcare workforce?
It really was, at least for me, I didn't know how to study. I did poorly in high school. It wasn't until community college that I learned how to study. And I learned those skills, I used those skills at Stanford for medical school, those same study skills. And so I do think, as mentioned, I think it's an untapped resource. I think recruiting early and encouraging students to consider a career in medicine and other healthcare fields it's a good source. Just like you said, it's a very diverse pool. And to better use them and include them, it's to create pathway programs where we have, in California, we have the California Medical Scholars Program, which is in development, where they're linking community college. But it really is, it's providing mentorship and guiding them, but it's not guaranteed acceptance. And that's where I think taking it a step further and guaranteeing these students and creating even a quota for medical school so that they can better reflect their community is a strategy for diversifying the workforce.
Mm-hmm. Doctor, thanks very much. And before I conclude, I want to commend Dr. Cook for telling your story here today. The fact that you attended Drexel helps in my estimation. But it's a great American story, and I know you worked hard to achieve it. So thanks for being here today and providing that testimony. Thanks, Mr. Chairman.